Yeah? Are they? Irritable bowel, constipation, yeah? But that may not always be leaky gut, right? It could be so many things. What else? I can't hear you. You can take a microphone. I don't know what's happening here. Food intolerances, okay. Oh, hello. Okay, so food intolerances is one. Okay, so let's delete this and go here. Okay, so one person has said food intolerances, right? Okay. What else? Huh? Skin issues, yeah, they could have allergy, they could have other issues, but not all skin problems could be, leaky gut. So how could you really tell this patient has leaky gut? So one of the simplest ways in questioning is stress. That's one of the causes of it. But how do you know the patient has leaky gut? Now look, you can do things like zonulin testing, which are super expensive to do. There's some easier ways, just by questioning the patient. Just think about it. Patients who have leaky gut, what do they tell you? Huh? Okay, so let me try to answer. The symptoms of the patient will always be variable. They will improve one day, become worse the other. They are never stable with their symptoms. They have fluid retention in their body, because once you have leaky gut, you're going to get fluid accumulated in your body. They're never stable because the patient's body responds to food, which means the person is eating different foods every day, right? So one day they'll say, I'm good, next day I'm bad. Some days are good, some days are bad. This is a very important statement that the patient tells you. Some days are good, some days are bad. You've had cases like this? Who's had cases like this? Could you put your hands up if you've had patients like this? Or yeah, Dr. Have any of you experienced this? Yeah? Some days good, some days bad. It means you have leaky gut. Right? So you have to understand that this is a very simple symptom. Another symptom of leaky gut is that vitamin D will be low. Okay, because vitamin D closes the epithelial cells of your gut. When you have leaky gut, your vitamin D will be down in order to keep those channels open. It opens up the space between your epithelial cells. Why is it doing that? Because it wants your immune system, which is beyond your gut, to enter to fight the infection. Leaky gut is nothing but a symptom of having an infection inside your gut, which your body is trying to eliminate. It is not a pathological problem. It's actually just an infection that you're having, or something going on in your gut. If you didn't have leaky gut, then that infection would build up inside your colon and toxify your liver, which is why patients end up having liver toxicity after they have leaky gut for a long period of time. Because there's so much of toxins building up in the gut, and that blood ultimately has to go to the liver to get detoxified. Patients also have piles for the similar reason. They have severely leaky gut. The liver is now toxified. Where does the liver throw its toxin out? Into the anal veins, and you have piles which have formed. So these are some of the symptoms that you need to watch out for. Okay? So again, I'll repeat that the patient's first symptom is that the symptoms are variable, they're never stable. Then they may have history of fissures, they may have history of piles, that is a second thing. You guys have seen patients who have fissures and piles, what they tell you is history, what kind of stomach problems they have. Yeah, they always have some stomach problems going on. Okay? And if the patient goes for a surgery for piles, to remove the piles out, now the last resort that the liver had to remove its toxins, that's also gone. So then the liver starts getting toxified, because nobody is bothered to treat that patient's leaky gut. So we know that leaky gut is just a response to an infection that's there inside your gut. Your small intestine, colon, both involved. So we know that infection is a cause. And we know that this low vitamin D is basically what is reflected. When I say low, it's really low. It's not like in the, say the normal range is 30, 35 and your level is 20. That indicates that, you may just be having lack of food sources or enough of sun exposure. When I say low, it's really low. Like the patient may have a vitamin D of 10, 12, 5. These are severely low vitamin Ds. And then you know that this fellow is definitely having leaky gut there. So just by asking questions and checking a vitamin D level, you can know what's going on with your patient. Okay? Just like how you could check your patient's protein levels and find out that they have toxic metals, a very simple test to do. What other symptoms could a patient have? One said that they could have allergy, they could have autoimmunity, bloating and gas. They could have GERD, they could have severe acid reflux. So the acid reflux may not be H. pylori linked. The patient may have SIBO and they may eat like 30 grams of carbohydrate. So I'll just give you an example. So 30 grams of carbohydrate, which is basically like a small plate, like the fruit which is kept there. If you eat 30 grams of carbohydrate and you have SIBO, you can produce 10 liters of gas out of that 30 grams. Just imagine 10 liters of gas in your colon in the night. Where's that going to go? It's going to come up through your stomach, going to open your lower esophageal sphincter, and you're going to have severe GERD because of it. Okay? So these are just some of the symptoms of leaky gut. Now we go into how do we treat it and how do we identify what to do. So in terms of treatment, what do we have? We basically invented this medication called as Zinc. So it's just spelled as Zinc. It's very simple. It's a combination of curcumin, which is complex to zinc. So curcumin has two forms. One is an active form, which is known as tetrahydrocurcumin, and the other one is the non-active form of it. So one form of curcumin is like an anti-inflammatory, which is your basic curcumin, and the tetrahydrocurcumin is actually like a pro-inflammatory agent. So even though curcumin is one agent, it basically has two sides of it. One side is anti-inflammatory and decreases inflammation, and the other one is pro-inflammatory. When you add zinc and complex it to that curcumin, it becomes into a completely different moiety only. It completely changes its characteristic. Now that curcumin actually is able to enter inside your intestinal epithelial cells. Otherwise, if you take curcumin orally, it cannot enter inside your intestinal epithelial cell. It enters through inside your body by combining it with piperine. It will not enter inside your epithelial cell. In fact, if you take curcumin with piperine, you cause yourself even more leaky gut because the piperine component of the curcumin actually damages your gut. So if you have leaky gut and you give your patient curcumin, nanocurcumin, whatever curcumin you want to use, actually going to make that leaky gut worse. But when you complex it with zinc, it's able to take the curcumin inside the intestinal epithelial cell and start doing quite a lot of interesting things, which I'm going to talk about. So one thing it does is it basically increases the level of something known as intestinal alkaline phosphatase. This is not the alkaline phosphatase that you see in your liver function test, this is the intestinal alkaline phosphatase. What this thing does is whenever there is LPS or lipopolysaccharide in the gut, it knocks the phosphate group off the LPS. Because it's knocking the phosphate group off the LPS becomes inactivated. So now it cannot enter your body and cause you toxicity. This is very profoundly important in diabetic patients. Because in diabetic patients who have high HSCRPs, they're having some sort of leaky gut which is constantly happening, and that LPS is floating around in the bloodstream. In fact, in our experiments, if we just took LPS and injected it daily into the rat, very minute doses, just little daily injections in the rat, within 1 week the rats all turn diabetic. Okay? So for most diabetic patients, that LPS is the one that causes them that diabetes. So when you give this Zinc to the rat's blood sugar levels would fall because the LPS is getting knocked off. Then the second thing that this Zinc does, it increases the levels of Paneth cells. If anybody has heard of what a Paneth cell is, these are cells that line your intestinal barrier. They are one of the cells besides the intestinal cells. They help to increase molecules like antimicrobial peptides, which are like alpha defenses, beta defenses, and they just go and target the bacteria and kill them off. So by increasing panel cell numbers, you are able to remove bacterial infections off your gut. Third thing is it increases mucus in the gut by increasing goblet cells. We found that patients who have severe constipation, when we give them cursing, the constipation improves quite nicely because it's making more mucus and knocking all of those toxic bacteria off. So these are a few things that the cursing does. We've also given cursing to patients with epilepsy. I'm sure there are a few doctors here in our group who've done patients of epilepsy using cursing. We find that these patients' tremors decrease really rapidly. What we notice when we are giving cursing to our human patients is sometimes patients who develop like a headache after taking cursing. So for 2-3 days, they will get a headache. We wonder how is that connected to epilepsy? Because cursing actually increases blood flow to the brain quite rapidly. So within 10 minutes of taking the dose, they start getting a slight headache. And then we tapered down the dose, and then after a few days again when we restarted the dose, there was no headache. This is exactly how it's working in epilepsy. It's just increasing blood flow to the areas of the brain which are damaged. So when we give cursing to patients with rheumatoid arthritis, with patients with psoriasis, patients with diabetes, patients with any autoimmune disorder, you name it, it works in it. So this is one of the things that we are doing. What are the different factors that lead to leaky gut? I'm going to talk about. So we basically divide this into a simple anagram called NSAIDs. PYT. So these are all the factors that lead to leaky gut. Okay. The first is NSAIDs. We're using a lot of paracetamol. A lot of patients are addicted to taking Arcoxia. They're Arcoxia fans. They take a lot of Combiflams. All these NSAIDs actually worsen your gut function because they lower your glutathione levels. So if a patient comes to you with chronic painkiller use, you need to be able to taper it off or give things like myfoscolil. So myfoscolil has the ability to remove NSAID-mediated toxin to the gut. Or you could basically simply decrease or stop the NSAID. Second one is sugar in the diet. A lot of sugar in your diet is obviously going to cause the growth of toxic bacteria. So a lot of kids will come to you with ADHD, totally hyperactive. You guys have seen that? Hyperactive kids on sugar. Parent gives one glass of like a sugary drink to the kid and the kid is like jumping around the house the entire day. That's because of the sugar in the drink which is causing an excessive growth of bacteria. Third is alcohol. Alcoholic patients have severe leaky gut, very, very severe. Is inflammation. Inflammation anywhere in the gut or anywhere in the body will trigger leaky gut. So if your patient has any chronic inflammation of rheumatoid arthritis, osteoarthritis, any inflammatory disease where the ESR is up, any inflammatory disease where the CRP, ferritin is up, you are going to have a side effect of having leaky gut. D would stand for deficiencies. So you could have deficiencies in zinc, in omega-3. I think there was a speaker talking about the role of omega-3 in tachycardia or ventricular tachycardia, right? So omega-3 deficiencies also lead to leaky gut, as do zinc, as do vitamin A levels. Now there's a side effect of giving omega-3. Has any speaker who's spoken on omega-3 spoken about this? You can Google it as I speak. There are published papers that show even slightly higher doses of omega-3 can lead to fatty liver disease. Okay? So if you're giving omega-3 to your patient blindly, you can actually cause them fatty liver disease and cause them liver cirrhosis. And how fast will this happen? Within a period of a month of overdosing. So when I say that omega-3 is low, you should be able to tell, isn't it, before giving the patient if your omega-3 is low. Could anybody tell me what symptom a patient could have if their omega-3 is low? How will you know? Skin is dry, but that could be low due to thyroid disease as well. It could be low due to low estrogen as well. What else? Do you test their omega-3 before you give them? Expensive, right? So you don't. So you just give the omega-3 hoping something good will happen. But something bad could happen as well. We could get fatty liver disease and liver cirrhosis in as less as a month. So one symptom of low omega-3 is chapped lips. The person will have chapped lips. The lips will get chapped, and you know the edge of your fingernails, the skin starts to flake off. Okay, what is the medical terminology for it? I have forgotten. But the skin right at the edge of your nail becomes rough and starts to like flake off. That's a very interesting symptom of low omega-3. Has anybody had this problem of the chapped skin on the fingernail? Who has it? You can put your hand up. Or you've had any patient having it? The skin on the edge of the fingernail starts to flake. Have you had a case with this? Anyone? No? So you can just ask the patient that. You just look at their fingers and look at that skin over there. If it's all rough, the skin is just peeling, that's low omega-3. Yeah, so you can give omega-3 in those cases and help the patient. Yeah?
Can we conclude that without that symptom there are enough omega-3?
Yes. If they don't have the symptom, usually the omega-3 is sufficient. Okay? And you don't need to overdose them on it. Maybe you can give them low doses of it, like using cod liver oil or things like that, but nothing more than that. Don't give them super high doses. There's so many people I see selling high doses of omega-3 and higher doses and even higher doses. For what? How do you know the person even has low omega-3? It's not like it's a super easy to detoxify by your body. It's not. It just causes liver disease. Okay, so that's vitamin D. That's omega. Then it's zinc. Then vitamin A. Okay. And even glutathione. Low levels of glutathione can cause it. So what is the most peculiar symptom of low glutathione? Have you guys had a viral disease and faced lower back pain after the virus went out of your body? Has anyone faced that? Lower back pain after COVID? Who's faced it? You can put your hand up if you faced it. Okay, Dr. Julie has faced it. Yeah, you also faced it, yeah? That's a symptom of low glutathione. The first symptom is severe lower back pain. So my wife about 5 years ago had a bout of severe lower back pain. Okay? She's not osteoporotic, nothing wrong with her. Randomly I checked her vitamin D to understand it was only 5. I said, oh my god, your vitamin D is 5, let's check your calcium. It was normal. I said, okay, maybe I have to give you vitamin D. Gave her vitamin D, high doses, 60,000 IU. Nothing changed in the back pain. She couldn't even get up from the bed. Then it occurred to me that I've seen this in my patients with dengue, where they have severe back pain and only glutathione has been able to fix it. So I get 1200 mg of gluta and I give it to her. Voila, the back pain resolves until the end. By the time the IV ended in half an hour, the back pain was gone. Then I start doing this for so many other patients by asking them, do you have back pain? They say, yeah. I look at other possible causes of back pain like a disc compression or whatnot. If there's none of these symptoms and the patient still has back pain, gluta is the way to cure it. So you could just be glutathione deficient and have that. And she clearly had leaky gut because her vitamin D was only 5. And a month before that, she had a viral infection. It was a difficult to treat infection. It took about 4-5 days to treat. She had bad diarrhea and she had a very high fever. So we had to give her some NSAIDs for that. This was a long time back. And that had triggered the low glutathione. So these are some of the symptom-based methods that you can understand if those deficiencies are there. Then comes stress. Oh my god, who's not stressed? Everybody usually is. So stress is a factor that causes leaky gut because when you're stressed, your body basically says the stress is mainly coming from the environment. That's what it thinks. So it's dumping your immune system into your gut, thinking that that's where the stress is coming from. Okay? So again, how will you know that you're stressed? It's a weird question, but how will you know that you are stressed?
Loss of hair.
Loss of hair may not be because of stress, it could be due to so many other factors. Unless you're plucking your hair out, then you know that you're stressed. Okay. So how do you know that you guys are stressed? Anyone can tell me.
Heart rate.
Okay, so you could breathe hard, but that's only during acute periods of stress. What about chronic stress? Huh? Okay, so you could check your cortisol, that could be low, you could have low cortisol levels, you could have low ACTH levels. If your cortisol is low, what symptom would you have? Huh? You can just use a microphone. That's just, excuse me, can you give people a microphone? Short breathing? Okay, you use a microphone.
Salt and sugar craving?
Salt craving, yeah, you could have salt craving. Sugar craving may not be that much unless you're hypoglycemic as well, but if your cortisol is low, you definitely have salt craving, and added on to that is what you're saying, a sugar craving also could suddenly come in. Okay. So salt cravings are a really important marker of low cortisol. Hypoglycemic attacks, the blood pressure could all of a sudden tank. The patient could develop postural hypotension. Okay. And renal fatigue, so they're tired all the time, they're very fatigued all the time. These are few of the symptoms. If the ACTH is low, anybody know any symptom of low ACTH? Lack of appetite. Appetite would start to tank. You would not feel hungry. The ACTH has tanked. So you have to be able to understand if the patient's ACTH is low or the cortisol is low. Based on that, you could appropriately treat the patient. Okay.
How about blood pressure increase?
Blood pressure increase may not be due to low cortisol. It may be due to high cortisol, which could also be due to stress. Because when you are stressed in the beginning, the initial phase